It's always going to be a very personal choice as to what surgical equipment of any sort that somebody would use. And you have to feel that it's right for you, and you have to be comfortable and confident in whatever product, whatever instrument you are using. The reason why I think PuraBond is good is, first of all, it's very simple to use. So there's no preparation required. You just open the packet, connect the cannula, and off you go. And it's such a safe product. So I would advise anyone that wants to use it, they don't need to worry that it's going to cause an adverse reaction as long as it's used within its licensed methods of use. My name is Jonathan Joseph. I'm a consultant rhinologist and facial plastic surgeon. My NHS practice is at UCLH in London, and I also work in a number of private hospitals in the London area. I first heard about PuraBond through a contact that I have from a previous product that I use regularly in my current practice. So he explained to me more about it. We gave it a trial, then I started to see more of its applications for use and whether it could be helpful for my practice. The procedure which I mainly started off with for PuraBond was turbinate surgery. I've put PuraBond in onto the surgical site at the end of the procedure, particularly where I've made a cut or I've entered the turbinate itself, and injecting the PuraBond into that area and spreading it over has had a good effect. And because of the numbers of patients, I could use it on quite a large number of patients and see that it was useful. In more recent times, particularly with the pandemic, patients are awake and the local anaesthetic. So any awake patient, control of bleeding is particularly important because it's harder to control it if there's a problem, and of course it's very uncomfortable for the patient, and if we want them to be able to go home relatively quickly afterwards in a sort of ambulatory context, then we need to be sure that the bleeding risk is minimal and they can go home safely. So PuraBond clearly has an indication and use in this context. Once the procedure itself is finished, laying the PuraBond nicely over the raw mucosal surface allows you to be sure that the bleeding will be minimized, but also because it's a clear gel, I can see through the gel and know that what's going on underneath is nicely controlled, and then I can finish the surgery and not have to worry. Other reasons why it is useful, so the delivery technique in terms of how easily you can actually apply it to the area where you're trying to get to is quite ergonomic, and it works fine. So I have used it in tonsillectomy where you can't just place a dressing on that area, so we thought that maybe PuraBond could be useful in that circumstance. And firstly, it allows me to reduce any oozing that can happen at the end of the surgery, and therefore I need to use whatever heat device that I would choose, such as diathermy or coblation, to control the bleeding. So that leads to less pain for the patient because less heat is used. Also reduces the risk of infection because there's less necrotic tissue which could become infected. What I've found with regards to nasal surgery, particularly with rhinoplasty surgery, when I come to see my patients on the ward post-operatively, they often have a little bit of oozing of blood from the nose, which is unpleasant. So I've tried using PuraBond on the incisions within the nose, and this has helped to reduce that annoying bleeding post-operatively, particularly on the ward, and that allows the patients to go home more quickly, more comfortably.